Now, let us move on to the next topic, which is pigmentary diseases. Two types, hyperpigmentation and hypopigmentation, we are going to see today. Disorders of hyperpigmentation includes melasma, which is a hyperpigmentary brown macules. This occurs at the malar, mandibular area, and nose. Melasma-like pigmentation on nose is seen in chikungunya, which is known as chick sign. Freckles. These are melanocyte number. Here, melanocyte number is normal, but the melanocyte activity is increased. It is associated with xeroderma pigmentia. In lentitions, melanocyte number is increased and activity is normal. Next is Pitt-Sugar syndrome. It is autosomal dominant with mucosal lentitions plus hematomatous GI polyps. Next is Baker's nevus, as seen here. It is acquired, it is unilateral, hypopigmented, hypertrichotic, and site is chest, upper back, and shoulders. Next is dermal melanocytosis. Melanocyte proliferation in dermis, blue slate gray color, ceruloderma. Mongolian spot. Bluish macular lesion in child at the lumbosacral region, and it resolves spontaneously. Nevus of Ota and nevus of Ito. Both are unilateral. Nevus of Ota follows the ophthalmic and maxillary route of trigeminal nerve, and this occurs at the face scleral involvement in 2/3 cases. Nevus of Ito runs along the post supraclavicular and lateral brachial. It occurs at the shoulder and scapular region. Treatment of both includes Q-switched NDX laser. Let's see one previous year question. After using NSAIDs for 5 days, a male patient with a history of feverish joints and back discomfort experiences hyperpigmentation across the nose. Here, what is the diagnosis? It is chick sign seen in chikungunya. See here. Let's move on to the disorders of hypopigmentation. Albinism. Here the defect is in tyrosinase enzyme. There are types which includes ocular, which is eyes and oculocutaneous. It includes eyes, hair and skin. Pybalidism. It is autosomal dominant. Defect is in neural crest cells and forehead becomes white, seen here. And there is white hair also. Next is nevus depigmentosus. Normally, one melanocyte gives pigment to melanosome, which gives 36 keratocytes. In this case, the conversion to melanosomes is hampered. This. So the area occurs depigmented. Nevus anemicus. Here the defect is in congenital white patch of vasoconstriction, skin lesion, decreased blood supply, and this lesion becomes hypopigmented. Disorders of hypopigmentation. These upper were the congenital, and now we are going to study the acquired disorders of hypopigmentation or depigmentation. It includes vitiligo. It is acquired, chronic, and depigmentary disorder. Here, melanocytes are absent. Classification: segmental, non-segmental, unclassified or undetermined. In segmental, It is it occurs from childhood. It is unilateral segmental. It does not cross the midline, and surgery is preferred. In non-segmental, face, head, and distal extremities are included, and acrofacial vitiligo. It is called acrofacial vitiligo, and mucosa. More than one site is involved. It is called mucosal vitiligo. Most common type is vitiligo vulgaris. Bilateral symmetrical macules can be seen, and in universal vitiligo involving more than 80 to 90% of the body. Unclassified or undetermined. These are small, isolated, depigmented lesions, which is called focal vitiligo. This is focal vitiligo. This is segmental, acrofacial, vitiligo vulgaris, and universal vitiligo. That is vitiligo vulgaris, acrofacial vitiligo. Clinical features includes wide, chalky, depigmented macule, true Koebner's phenomena, in which new lesions along the trauma line are seen, and leukotrichia, which is white hair. If present, then it indicates bad prognosis. Here, the treatment is topical, includes corticosteroids and tacrolimus, and systemic treatment includes steroids, azathioprine, and phototherapy with narrowband UVB radiations 311 plus or minus 2 nm. Chemical leukoderma. Here, chemical induced melanocyte destruction is seen. For example, in bindi, the allergens is PTBP, which is para-tertiary butylphenol, and in rubber, MBEH, which is monobenzyl ether of hydroquinone. Thank you.